Women really don't like the feeling of their breast hanging down.
Right, or they want to not wear a bra.
Not wear a bra. It depends on the severity of what you have, what we're going to do. If you have saggy breasts but no breast tissue there, you're going to need to add volume, and that's where we would do a mastopexy augmentation because they want some fullness of their upper pole or above the nipple and areolar complex. So that would be the person that has breasts that would benefit from a breast implant, and the benefits would be contour improvement, size increase, improved symmetry. Why do breasts sag?
Loss of tensile strength in those tendons and ligaments and the soft tissue that support the breast. Even a woman who has very small breasts can still have a lot of descent of the breast itself. So the nipple and areola can still descend, even though there may not be a lot of weight behind it.
Because in this situation, when you have saggy breasts, one of the main issues usually is the nipple and areola below your fold. If you take a finger and put it on your inframammary fold, and take your thumb and press down right on top of your finger, your nipple and areola should be at that level or above. And if it's below that, then you know you need to lift the nipple and areola. But also, the things you see with this, especially with age or after pregnancy, is all the stuff of the breast goes down. So the nipple and areola location needs to usually, in almost all cases, go up. And so you're going to move that back up into its normal position.
Two main types of mastopexies that we do anymore are going to be a lollipop or a periareolar. Less likely that we need to do an anchor with a straight mastopexy. Those are more common if someone is also doing somewhat of a reduction.
So a natural approach to breast augmentation, you start with your breast width, and depending on how much, number one, volume you want, okay, but also how augmented you want to appear, the projections just get bigger and bigger.
A 385 cc implant in a full projection, right? So it's a full projection. And then this is a 480 cc implant in a boosted full, so kind of in a full plus, essentially, right? This is 100 cc's difference. This seems like so big to people when I'm trying to convince them to size up a little.
And these are about the same width.
They are the exact same width. And that's why I picked.
So this shows you less projection, more projection, less projection, a little more flimsy, more projection. Obviously, it holds its form factor. That's the word we use. Better.
You see how much more stability this implant has at the top.
So the overfilled implants are going to have, in most cases, less rippling.
Yep.
Okay, which rippling can show through the skin.
So if you really are wanting a lot of upper pole fullness, your surgeon may recommend a higher projecting implant.
Upper pole is above the nipple and areola.
Yeah, also more fill. So this is the same base width. So this could be the exact same person based on how much fullness they need in the top and also how much support their breast needs. How much breast tissue they have. And
the width of your breast, that's as far as we can go, and you can't go too narrow either. You can't make it not the width of your breast too, because that looks weird too. So you have a set diameter, a set width, and then you can just adjust the projection to what you need. That's pretty simple to me. But there's technique involved in this whole surgery, doing all the things you need to do a legitimate breast augmentation surgery. Also, really working with the patients and listening to what they're saying and what they want.
And what their lifestyle is.
Their lifestyle, their aesthetic goals, what they want for the long term. And then going from there.
Downtime and recovery is what everybody wants to know. Like, how long will I put life, driving, work, sex, etc. Because these are the things that come up. Like when can I get back to working out? When can I drive? When can I vacuum? When can I do my own laundry? And you can get back to most lifestyle things like working if you have a job that's not physically active, probably driving, by about a week out with some restrictions. There's a little bit of a holdover effect when you're just coming off of pain meds, like that people I think maybe do too much. Bigger things like
driving off pain medications for 24 hours.
At least. And that my preference level is 48, just to make sure you're actually not feeling pain. Vacuuming, laundry, those are things you will need help with for a couple of weeks.
Tell them about the alligator arms.
Crocodile. T-Rex.
Yeah.
So this is your world. I always tell people, and this is usually what I'll do. I'll be sitting up at the front desk. We'll be kind of going over all this stuff and I'll grab something and like throw it just too far away from myself and be like,
you can't grab it.
I can't grab it,
Just imagine your arms were only as long from your elbow to your hands.
Yep, and that's it. And they can't move
That's
from
what
there.
you got.
Making those changes ahead of surgery, putting things down on low shelves, making sure your remote control is close or your phone charger or whatever you need is close by and you don't have to reach for it, especially if you don't have someone who can do those things for you, is very, very key. People who have heavy dishes, I'm like, put dishes down low for the couple weeks after surgery. Getting back to things like sex and working out, sex is usually okay at 2 weeks, with some precautions that it should be comfortable for you. And then anything that hurts you need to stop right away. Working out is going to be...
You just don't want to elevate your blood pressure too much.
And your heart rate.
And your heart rate, because that can lead to swelling or even bleeding around the implant in delayed fashion.
Back to working out, legs, 2 to 4 weeks out, and upper body is okay at 6 for most practices. And again, always check with your surgeon, because we are not your surgeon potentially. Like as you recover, your scar is continually remodeling and rebuilding itself. So there does come a point for most women in recovery where your scar is at its like reddest, like or most angry.
I love meeting in the middle and kind of coming to an agreement. It's invigorating, right? So then you can forge this new path mixed with both the experience of the surgeon and what you want. You're going to have your best outcome.
Yeah.